Well, some unfortunate shit that's been happening. Different companies, not basically different companies that are doing the wrong thing to keep society going during coronavirus. And the first one I want to talk about is Hahnemann University Hospital in Philadelphia. Well, let's go ahead and read the article here. We can talk about it as we go through it. A hospital with room for nearly 500 beds has been closed for months in the center of Philadelphia, a city bracing for the spread of the coronavirus and a crush of sick patients. When this article was published about 4 days ago, 5 days ago, excuse me, and updated a couple days after that. The facility will remain empty, city officials said, because they cannot accept the owner's offer. Buy the hospital or lease it for almost $1 million a month, including utilities and other costs. This is the rent-seeking behavior we see from many capitalist institutions, where they're trying to create a situation where they don't have to do anything and they get money in. So either he gets a massive paycheck or he gets a recurring paycheck each month. We don't have the need to own it nor the resources to buy it. So we are done and we are moving on, Mayor Jim Kenney told reporters on Thursday during the city's daily briefing. The next day, he said that Temple University would let the city use a music and sports venue for free. The city would no longer pursue the closed facility, Hahnemann University Hospital. This means that the people in Philadelphia who get sick with the COVID are going to be being taken care of at a music and sports venue, so basically an auditorium, stadium, something of that description, instead of an actual medical facility designed for people to use. The abrupt end of the dispute underscored the frantic search for more hospital beds as cities try to prepare for a crisis that is overwhelming medical facilities in New York, and highlighted the tensions between the government officials and businesses in response to the pandemic. This week, the Trump administration backed away from announcing a $1 billion deal with General Motors and Ventec Life Systems to produce ventilators after officials said they needed more time to assess the estimated cost. In Philadelphia, coronavirus infections are quickly rising. On Friday, the city health commissioner reported 154 new cases for a total of 637 cases across every zip code of the city and 3 deaths. This virus is everywhere in Philadelphia. So this is a city that's going to be hit hard if there are already 600 cases. And that number has likely gone up in the last week. The owner of the hospital, Joel Friedman of Broad Street Healthcare Properties, a real estate company, said he had offered to sell the facility to the city well below market price or to lease it for $60 a bed a day, far less than what 2 other hospitals in California agreed to charge to lease their facilities. The issue is that it's sitting empty now. No one is in there. So it's not like it's just not available for the city to use, but it's still being used. It's just an empty building right now. Anyone looking at the apples to apples comparison can see that Mr. Friedman not only desired to be helpful to the city of Philadelphia and its leaders, but he was very reasonable. Only from a bloodless neoliberal stance. I don't see it as reasonable to say that, well, you can only use my hospital if you're going to pay me for it. Fuck you. It's as simple as that. People are going to die because he didn't let the city use this hospital, or he demanded a massive payment for it. And Mr. Friedman isn't even in Philadelphia, so he's not even going to. There's not going to be any fallout for him because he's across the country. We're disappointed that they didn't accept what we offered, but we stand ready to be helpful to the city or state if they want to reopen discussions. Mercenaries. Hahnemann Hospital, which once served the city's poorest patients, closed in September 2019. The hospital had been suffering millions of dollars in losses a month. The Philadelphia... Right. It's expensive in our system to run a hospital, particularly if you typically serve poor people, because poor people don't pay. I'm a poor person. I'm not talking shit about anyone here. Poor people don't pay. We relentlessly pursued numerous strategic options to keep Hahnemann in operation and have been uncompromising in our commitment to our staff, patients, and community. We are faced with the heartbreaking reality that Hahnemann cannot continue to lose millions of dollars each month and remain in business. The decision to close the hospital last year infuriated local leaders and led Senator Bernie Sanders, the Vermont independent running to be the Democratic nominee for president, to hold a rally outside the hospital. Well, good way to bring attention to it. He described the closure as a consequence of greed, an example of the need for a better healthcare system. Right. To get back to what I talked about earlier when I talked about the medical staffing and Dr. Damian's manifesto, the problem with our system, with our medical care system, is the people at the top who ultimately make the decisions are not the same ones who know what is best for our system. Mr. Singer said Mr. Friedman had been unfairly maligned throughout the recent dispute, and that his obligations included maintenance, compensating his staff, and paying off the loan he took out to buy the property. Because, of course, that paying off the loan is the responsibility of the city and the hospital rather than the person who took out the fucking loan. They've wrongly been critical of Mr. Friedman. We understand that emotions are high. We don't want in any way to hold that against them. Easy to be all high and mighty like that when you're basically saying, well, we'd like to let you use the hospital, but we want to make sure that we're going to get paid first. Even with those harsh words, our doors, our ears, our minds are still open. We want to help, but only if we get paid. Kind of sound like a broken record at this point, but it's the recurring issue. Yeah, the constant issues with making sure that people get paid is a lot of what's causing a lot of the issues and cracks that show in our system. Not the least of which is red line go down. Since last fall, the hospital has sat empty and fallen into disrepair. It has no beds and requires extensive work to make it usable again. So that is another issue. And probably a big part of why the government of the city decided not to purchase the building, because it would require a great deal of money and time and effort to make the hospital usable again. Mr. Kenny said the city had offered to lease the hospital for a nominal amount and pay for its maintenance and expenses, a deal that would have meant hundreds of thousands of dollars a month for Mr. Friedman and made the property more marketable in the future. That seems reasonable. I'm not typically one to side exclusively with businesses and the like, or excuse me, side with governments, although I generally will side with them against businesses. But this seems reasonable. Again, this is an example of a capitalist pursuing short-term profit over potential long-term profitability. What's he doing right now? It's sitting empty. He's probably getting a bit of tax credit or write-off for owning the building. That's why a lot of real estate prices are so high, because they can sit empty. But otherwise, he's not making any money. He's not making any rent. He's not making any income from people coming into work. He's making none of that. Instead, he's paying off the loan, which I'm sure he can handle no problem. But again, he's sacrificing short-term profit, or he's sacrificing potential long-term profit because he wants to increase his short-term profit. Instead, Mr. Friedman wanted the city to pay $400,000 a month in rent, in addition to making improvements and paying for other expenses, Mr. Kenny said. I'll let others decide whether that's reasonable or not. I mean, it sounds like the city probably agreed to the rent, but there was some disagreement about who should be responsible for renovating and upkeep and things like that. Mr. Singer said the city contacted Mr. Friedman around March 11th about leasing the property. We responded immediately and said, yes, we would like to help in any manner. Mr. Friedman offered to sell the property below market price or lease it for $27 a bed a day. The city would have to pay an additional $33 a bed a day to cover the cost of utilities and taxes, he said. The full amount came to about $910,000 a month. They just decided we're not going to pursue Hahnemann, he said. Yes, because you made it too expensive. Austerity has meant that our city and state governments, let alone our federal governments, are running on shoestrings. An extra $1 million a month probably would have meant any number of social services would be cut for a 500-bed hospital. City officials had signaled that negotiations were breaking down earlier this week. On Tuesday, the city's managing director, Brian Abernathy, told reporters that what Mr. Friedman wanted was unreasonable. I think he's looking at this as a business transaction rather than providing an imminent and important aid to the city and our residents. That's exactly what he's looking at it as. This is the problem with commodifying essential services such as medical care. Everything is a business transaction. Nothing is providing aid unless it also puts money in his pocket. Whether through, and just to be clear so no one tries to gotcha me on charity and things like that, but charity puts money in your pocket when you claim it on your taxes. I'm not entirely clear on whether it's a tax credit or you don't have to pay taxes on what I'm not entirely sure, but I know for a fact that charities make a lot of money come tax time from people wanting to write them off on their taxes. City Councilor Helen Jim said on Twitter that day that Philadelphia should not let unconscionable greed get in the way of saving lives, and called for acquiring the property through eminent domain. Mr. Kenny said city officials had explored that option, but determined it was too time-consuming and would require them to purchase the building at market price. Yes, that is one of the dirty little secrets of eminent domain that a lot of people don't talk about, is that, yes, you can come in and say, the government can come in and say, I am taking this property, but they then have to pay for it. Like, you can't tell them no, but they also then have to pay for it if that is the method they pursue. Mr. Kenny said in a news conference Friday that the city would use the Liacoris Center, a concert and sports venue at Temple University, for additional hospital space. The university will let the center be used for free, and the space can fit up to 250 beds. So instead, they got half the beds. Yeah, on a basketball court. I mean, it's certainly better than nothing, but it's still not great. There's no way that will come close to the sanitation requirements of a hospital. But again, better than nothing. Hey, thanks for watching. Hope you enjoyed the show. If you liked it, like, share, subscribe, and leave a comment. Thank you. See you next time.